Colon cancer is now the second most common cause of cancer-related deaths in the United States. What we are seeing in colon cancer is unprecedented because colon cancer has become a disease of younger people. Colon cancer previously was mainly seen people over age 65. Now we're seeing every week people under age 50 or 45 showing up with colon cancer. So it's very, very disturbing, and we honestly don't know the reason why we're seeing such an increase. Some attribute it to more screening, but the issue is that a lot of these people that are showing up with colon cancer are screened because they have symptoms. The age of screening in the United States for colon cancer was age 50, and because of this huge increase in young people with colon cancer, it's now been reduced to age 45. Some researchers think that it should probably be even younger than that, age 40. What we find extremely concerning about this is that up to 70% of colon cancer is preventable. And so the question really is, when does the clock start ticking? At what point can we start doing things to prevent getting colon cancer? And I think that the research and science is suggesting that we probably need to start doing it at a very young age at schools. We eat from vending machines, processed food. There's a huge amount of data now on the importance of exercise. And exercise is not only what we call anti-inflammatory, but it has a significant effect on the immune system, and that may be preventative against colon cancer. Other factors, such as obesity. The United States has one of the highest incidences of obesity in the world. And obesity is certainly associated with colon cancer, but it's also associated with many other cancers as well. So diet, nutrition, exercise are all very important factors. There are two buzzwords now when we talk about colon cancer and other cancers as well. We talk about the role of inflammation in causing cancer, and then what is considered anti-inflammatory, things that we can do to reduce inflammation, such as exercise, such as eating healthy foods, fruits and vegetables, that can protect our bodies against getting colon cancer. So we're learning a lot about this disease, but there's a lot that we don't know as well. And it's just particularly disconcerting that by the year 2030, colon cancer is going to be the leading cause of cancer-related deaths in males under age 40, and the second leading cause of deaths in females under age 40, second to breast cancer. So these are very, very alarming numbers, and clearly we need to do more to prevent colon cancer. Screening has become so much more simpler. So screening, as we think about it, is colonoscopy. That's the gold standard. And colonoscopy is really only recommended for people over age 45. But now we have home stool-based tests. We have what are tests known as FIT tests, Cologuard. These are home tests that don't require bowel preparation. It just requires simply sending in a stool sample to a lab, and then that result is sent to your doctor. And they're very sensitive. And so these tests can be used more frequently, and certainly in people that are lower risk, perhaps need to do fewer colonoscopies. Another important factor in colon cancer is that up to 15% of colon cancer is genetic. So if you have a family member that is diagnosed with colon cancer at a young age, under age 50, it is important to go and talk to your doctor or talk to a geneticist and get tested to see whether you are someone that is at high risk for developing colon cancer at a younger age. Fortunately, our treatments for colon cancer are a lot more effective. Surgically, we do robotic surgery, which allows us to remove segments of the colon. It's minimally invasive. Patients are often going home 1 or 2 days after surgery with very little discomfort. So there's some really big technical advances in minimally invasive surgery. We also have a lot of new treatments for the more advanced colon cancers, whether they be chemotherapies, biologic therapies, and of course, immunotherapies, which are now front and center in the treatment of many cancers, including colon cancer.